Good morning. At this time, we'll call to order the Board of County Commissioners meeting for, will the clerk please call the roll?
Commissioner Schaefer.
Here.
Commissioner Allen.
Here.
Commissioner Clickham.
Here.
Commissioner Osterhaus.
Here.
Commissioner Ashcraft.
Here.
Commissioner Brown.
Here.
Chairman Islet.
Here. All are present. We do have a quorum. Would you join with me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Would ask those who are in attendance, if you have a noise-making device, if you could turn it to silent or off so as not to interfere with our electronic communications. We do have a couple of presentations to make this morning. We'll do so at this time. I'm going to ask Brent Christensen to join me at the podium. Brent, are you the only one, or do you have
We got a group over here.
a good-sized crew here
Yes.
this morning?
Yes.
Okay, well, I'll let you recognize that a little later. Our first recognition is the receipt of the Government Finance Officers Association certificate and recognizing the excellent financial reporting. As I understand, this is the 30th year.
Yes.
That our Treasury and Financial Management Department has received this recognition. That is outstanding. And so I'll present this to you in recognition of your outstanding effort, and I'm sure you can have some comments. We'll just leave that right here. It is heavy.
It is heavy.
And so you're welcome.
Thank you. Thank you. So good morning, Brent Christensen, and always I appreciate the Board of County Commissioners for taking a few minutes to recognize the accounting division within the Office of Treasury and Financial Management. As mentioned by the Chairman, this is the 30th consecutive year that TFM has earned this award from the Government Finance Officers Association. This achievement is only awarded to a few governments, and again, only 3 counties in Kansas, we were one of them, has won this award this year, and nationally, only 547 out of over 3,100 counties won this award. As you know, a comprehensive financial report, or CAFR is what we call it downstairs, serves a number of purposes for the general public, investors, and other interested groups. One of the most significant purposes of a comprehensive financial report is that it provides valuable insight into how Johnson County manages its public finances. This goal of this report is to provide a full financial disclosure, financial transparency, and promote accountability that is easily readable and efficiently organized for all to review. TFM does not accomplish this feat alone. We rely on and depend on lots of folks throughout the county. And I'd like to thank those staff members as well, including the divisions in TFM that would be payables, purchasing, payroll, benefits, cash management, treasury, risk management, as well as all the administrative staff, as well as staff from budget, legal, RTA, and appraiser's office, as well as all the fiscal staff across the county. We are also fortunate enough to work with a highly professional audit team from out of Wichita, Allen, Gibbs, and Hewlett. And at this time, I would like to recognize the following employees. While we might all have been here for 30 years, some of us have been here a long time, I'd like to recognize those employees for their role in obtaining this award. So if you please stand, and I call your name. Julie Highfill, County and Financial Reporting Manager, 8 years at the county. Jim Longmire, Senior Accountant, 13 years at the county. Curtis Yates, Senior Accountant, 4 years. Lisa Yu, Senior Accountant, 5 years. Greg Doggett, Accountant, 14 years. Jared Verholz, Accountant, 14 years. Lastly, she wasn't available to attend this meeting today, but starting April 9th, Becky Jones, who has done an outstanding job in serving as the Parks CFO for the past 7 years, will be coming back to TFM to serve as the next Assistant Finance Director, which the accounting staff will be one of her divisions, and I anticipate continued success by this group to continue producing an award-winning CAFR in the future. Thank you.
Well, congratulations, guys. Thank you very much for your diligence, your good work, your professionalism in bringing this positive recognition to your activities and the finance department. I think sometimes, you know, after 30 years, perhaps we kind of overlook the significance of what this award means, and we should not do that because the work that you do is vital to the successful operation of our total county government operation. So thank you very much.
Thank you.
And I'll pass this on to you.
Right. Thank you, sir. Appreciate it.
We'll want to take a photo here.
Yes, sir.
Thanks again.
Thank you.
And next, Robin Lines. How are you, Robin? Good to see you. We have a special proclamation. Robin is the purchasing manager for Johnson County, and we have a proclamation recognizing this month as National Purchasing Month. And I would just say this: I've not ever stood in your shoes, but I can imagine the significance and perhaps the enormity of the task that you have in conducting various purchasing activities for goods and other vendors who offer services to county government. And we appreciate very much the professionalism of your department and your activities. And so in recognition of that, I'll present this proclamation to you and to those who assist you. And if you'd like to make some comments, please do so.
Certainly. Well, good morning, Chairman Eilert and Commissioners. Thank you for doing the presentation of the proclamation. My name is Robin Lines. I'm the purchasing manager. I would like to introduce staff, but I would like staff to come up here and take a picture with the proclamation if they would. So we have Dale Bauer, who is the senior purchasing administrator, John Booz, purchasing administrator, and Amy Valerie, purchasing administrator. When we celebrate Procurement Month, we acknowledge an elite group of professionals that have made a difference in governmental efficiency and effectiveness. This month provides an opportunity to help educate elected officials, administrators, taxpayers, and vendors about the procurement process and the admirable work performed every day. Just to give you some statistics for 2017, the purchasing office processed $274 million worth of purchase orders in 2017. We also received $195,000 in proceeds from surplus, and we advertised 82 opportunities through our IonWave system, which is our electronic bidding system. We have been successful at having more and more departments start to advertise some of their informal processes, and we will continue to work on getting them up to speed and using the system as well. With that, I would like to thank everyone.
Okay. Well, thank you. Good job, guys. Thank you. Thanks, guys. Appreciate it. Yesterday was World Downs Syndrome Day. There are some in our county family and many throughout the county who are very, very familiar with working with those who have Down's syndrome. And so in honor of those and in honor of the National Day, Commissioner Klicka has a few words to say, and then we have about a 3-4 minute video which we'd like to share. So Steve?
Thank you, Chairman. Commissioners, I appreciate your indulgence on this, your time or attention on this matter. In my private life, starting when I was in high school, I became very active working with youngsters with special needs. And one of the groups of children that I worked with were youngsters with Down syndrome. And a lot of people don't know that involvement I've had all through my life and continues even forward to today. My wife, who has been equally involved and engaged with friends and families with children with Down syndrome. At the same time, in my time on the school board of Blue Valley, we had a lot of opportunity to interact with various families and youngsters in this area. With that in mind, my wife found a video that was just put up here in the last few days that is basically in honor of the world's Down Syndrome Day, which is yesterday, 21. And Penny, it basically represents 20 what is it? 20.
Those with Down syndrome have a third 21st chromosome.
And for that is why the date was fixed. My wife found this video, or it was brought to our attention, and basically it's a group of mums in England who decided to do a karaoke in the car with 4-year-old Down syndrome children. And with that, I'd like to turn this, ask that the video begin, and in honor of that day. For the commissioners who are passing out, there's a song that follows through, that you'll be able to follow through with us. Thank you.
Colors and promises.
Thank you, Mr. Chairman, Commissioners.
Well, thank you for sharing that. As the parent of a special needs family member, and I've always been thankful for the commitment that this community has made to programs, to activities, through the Johnson County Developmental Supports and other service providers, as well as our school districts, to recognize that each individual has unique abilities, and the programs that are in place is to help each person achieve to their ability. And that's one of the things that makes Johnson County a special place. So thank you to all for your sharing in that regard. And thank you, Steve, for bringing this to our attention. At this time, we'll turn to the public comment portion of our agenda. If there's anyone present who would like to address the commission on an item which does not later appear on the agenda, would invite you to the podium, state your name and address, limit your comments to 5 minutes, and we'll be glad to receive the information. Mr. Raby.
Good morning. Tom Raby, 17513 West 113th Street in Olathe. Some of the steering wheels on some of those cars were on the wrong side.
You're right.
I know you were looking at the kids, and that's important. Okay. I actually don't represent anybody except me, but I belong to a community of old folks who live on basically fixed incomes. And my wife and I have each been retired for almost 20 years. And there have been no quantum leaps in our income at all in that period of time. And very little of any increases. And we hope we will outlive our money, as many old folks do. Investments do not keep up unless you are wild and crazy with your money, with some guy who can just work miracles for you, and you better count your fingers after you shake hands with this guy, because I've known some old folks who lost money to various things, annuities, equities, various other legal schemes. These guys didn't put their hand in your pocket, literally. They just put their hand in your pocket with a smile and maybe a flashing neon light on their tie or something like that. But beware of the glitter. But that's just another story. There's been a lot of squawk, for lack of a better term. My vocabulary doesn't always use the correct word. Complaining, maybe, but a lot of mumbling and moaning and groaning about the real estate appraisals and business appraisals. And I think rightfully so, because not everybody's there ready to sell their house or sell their business. And even if the appraisal says it's worth X dollars, doesn't mean you can get X dollars for it. And there's a cost associated with unloading this property if that's your choice. And some of us have chosen not to pick up and move to Texas or Florida or South Dakota or some other state with no income tax. So we choose to stay here. However, we would like a lot better response from those nice people, like quote unquote, in Topeka. Real estate appraisals, now the reason I mention this to you guys is I know that the mill levy or the taxes collected by Johnson County is less than 15% of my taxes on my property, and probably that's roughly the figure for a lot of folks. But you guys, the Board of Commissioners and everything, you're the focal point. You have the duty of hiring the appraiser, and then you can't tell him what to do, and I've said that before. And but you also you're the middleman. You guys are apolitical. You can't go kiss the Republicrats' ring and work some kind of magic. But you're in the middle, in the collection part of this too, so that's why I mention it to you, because we know that those other entities on your appraisal form that hit you with mill levies, and mill levies, just because the appraisal goes up and the mill levy doesn't go up, does not mean that there's a dollar for dollar equivalency there. You're not in the same ballpark. I'm not an accountant, but even I can understand this. And those other nice entities on your tax bill, the school districts and park and recreation and the libraries and all of those other 4 or 5 that zap you with a lot more tax money than the county does, they're not going to lower the mill levy to make your costs stay the same. Oh no, they're going to put their collar up over their mouth and chuckle, like the evil villain that tied the fair maiden to the railroad tracks in those old movies. I mean, I hate to say they don't care, but I know I'm cynical. So the county government is our focal point. We're the guys that we come up here and squawk to you guys. And we know that the cities and the school districts and the others, they don't even respond as well as you do. So that's a plus. But it's only a 15% plus. We need some other pluses. And
Getting close to the end of your time, Mr.
I know. My closing point is that I've followed the legislature somewhat closely. I doubt they're going to change. You guys can get a few ears here and there, but if there's some young person in a government class out there someplace who watches this thing, I hope there is. I would hope that in your lifetime, you will get those people in Topeka off their duffs and get a voter initiative law passed in Kansas so that you don't have to wade through 7 years of bureaucratic entanglement to get something done. Thank you.
Thank you. Is there anyone else? All right, if there's no one else to be heard, that completes our public comment portion of our agenda. I do have several notes for the record this morning. I will be signing 2 partial release of easements for Johnson County wastewater due to the removal of sanitary sewer line, 1 at Mission Road and Bell Drive, and 1 at 151st Street and Rosewood Street, both in the city of Leawood. And an administrative resolution number WD 18-015 enlarging the privately financed sewer district and providing for the assessments on all applicable fees, charges, and levies of the consolidated main sewer district and consolidated lateral sewer district in the vicinity of 80th Terrace and Barclay Drive, and administrative resolution number WD 18-018 enlarging the privately financed sewer district and provide for the assessments of all applicable fees and charges and levies of the consolidated main sewer district in the vicinity of 159th Street and Quivira Road. The Fifth Amendment to the loan agreement with the Kansas Department of Health and Environment for Kansas Water Pollution Control Revolving Fund Project number C20-1920-01, Lateral Sewer District number 1 of Kill Creek number 2, revising the repayment schedule to reflect the amount of principal forgiveness based on the project payments to date. This amendment does not affect the loan amount. And an agreement with the City of Prairie Village for a preliminary engineering study of stormwater management project known as 84th Street and Reinhardt Stormwater Improvements. Again, an agreement with the City of Prairie Village for design of a stormwater management project known as 84th Street and Reinhardt Stormwater Improvements. And finally, an agreement with the City of Prairie Village for the public improvement of Rowe Avenue from 67th Street to 75th Street. That concludes notes for the record. We'll move to the consent agenda. Will the clerk please read the proposed consent agenda items?
Item number 1, consider ratifying the chairman's reappointments of Roger Cooper, Jane Fletcher, Judge Michael Joyce, and Gordon Docking to the Mental Health Center Advisory Board through February 5, 2021. Item number 2, consider ratifying the chairman's appointment of Anthony Privatera to the Transportation Council through August 31, 2021. Item number 3, invitation for bid number 2017-089. Consider authorizing a contract with American Roofing, Inc. for roof replacement at the New Century Pump House building for a total amount not to exceed $119,737. And item number 4, resolution number 015-18. Consider approving an agreement submitted by the City of Olathe, Kansas and Fire District number 2 of Johnson County, Kansas, and ordering the detachment of land from the boundaries of the fire district and the transfer of such land to the city for fire protection services.
Is there any commissioner who would like to have an item considered separately? Is there anyone present who would like to have an item considered separately? There being no one to be heard, it's back for the commission. Mr. Osterhaus.
I move that we approve the consent agenda as read.
Second. Motion's made and seconded to approve the consent agenda as presented. Will the clerk please call the roll?
Commissioner Schaefer.
Aye.
Commissioner Allen. Commissioner Clickup.
Aye.
Commissioner Osterhaus.
Aye.
Commissioner Ashcraft.
Yes.
Commissioner Brown.
Aye.
Chairman Eilert.
Aye. Motion carried. Items are approved. Moving to the action agenda, item number 5.
Consider approving the March 1, 2018 business session minutes.
Mr. Allen was absent, so I do need a motion. Mr. Osterhaus,
Move that we approve the March 1st, 2018 business session minutes.
do I hear a second?
Second.
Are there any additions or corrections to be noted? There being none, the motion to approve is before us. Will the clerk please call the roll?
Commissioner Schaefer.
Aye.
Commissioner Allen. Commissioner Clickup.
Aye.
Commissioner Osterhaus.
Aye.
Commissioner Ashcraft.
Yes.
Commissioner Brown.
Aye.
Chairman Eilert.
Aye. Motion carried. Next item.
Item number 6, resolution number 014-18. Consider City of Overland Park application numbers PLT 2017-127 and PLT 2017-133. Request for preliminary and final plat to allow expansion of an existing single-family subdivision to be known as Wilshire by the Lake West in the vicinity of northeast corner of 159th Street and Quivira Road.
Planning Director? Jay.
Morning, Mr. Chairman, members of the board. Jay Leipzig, Planning Development Codes Director. The site is brought before you by Phelps Engineering on behalf of the City of Overland Park for a preliminary and final plat for Wilshire by the Lake. It's an expansion of an existing 96-acre subdivision for additional 25 lots in the final plan, or final plat. The Airport Commission approved this on February 28th. The City of Overland Park approved it on March 5th of this year, and staff is also recommending approval.
Just for clarification, this development is in the City of Overland Park?
Yes, that's
Before us because of the proximation to the airport, is that right?
Yes, that is correct, sir. It's within the 1 mile jurisdiction of the airport.
Okay. Are there questions? Thank you. Is there anyone present who would like to address the commission on this item? Being no one to be heard, is back for the commission. The motion is in order. Mr. Klicka.
I move that resolution number 014-18 be adopted, approving City of Overland Park application numbers PLT 2017-127 and PLT 2017-133, requested for preliminary and final plat for residential subdivision be known as Wilshire by the Lake West, which is located within 1 mile of the Johnson County Executive Airport, for the reasons and subjects to the stipulations set forth in the resolution.
Second.
Motion's made to approve the resolution and the applications as noted. Is there any further discussion or questions? All right, there being none, clerk, please call the roll.
Commissioner Schaefer?
Aye.
Commissioner Allen? Aye. Commissioner Clickham?
Aye.
Commissioner Osterhaus?
Aye.
Commissioner Ashcraft?
Yes.
Commissioner Brown?
Aye.
Chairman Eilert?
Aye. Motion carried. Item number 7.
Request for proposal number 2017-069. Consider authorizing a contract extension and amendment with Crystal Clear Enterprises for custodial services in an amount not to exceed $290,000 to cover the time frame from May 1, 2017 to April 30, 2018, and authorize a new countywide term and supply contract for custodial services with Crystal Clear Enterprises, Inc. at a cost not to exceed $875,000 annually for a period of 24 months with the option to renew for 3 additional 12-month renewals.
Ms. Lyons.
Good morning, Chairman Eilert and Commissioners. Again, Robin Lyons, Purchasing Manager. The item before you is twofold. Both items are with Crystal Clear Enterprises Incorporated for custodial services. The first item for action is the contract extension and amendment for $290,000. The second item is the countywide term and supply contract for annual custodial services in the amount of $875,000. With that, I stand for questions.
Questions? Mr. Clickham?
Robin, I recognize we had extensive conversation last week on this, and I appreciate the comments, or you kind of advised me to what the challenges were. The challenge was the termination of that contract, or the end of the term, was not flagged, and then we're in the midst of dealing with adding on arts and heritage and just a number of issues, and we had vendor problems. Have those problems been resolved?
We are working on that with this new contract. We will be transitioning all of our buildings over to this new contract.
But to avoid, and my comment was that this did not get flagged as far as timing and so forth. Have we been able to get the system adjusted so we don't come across this again?
So as stated last week, we have implemented the IonWave electronic bidding and contract management tool. It was implemented in January of 2016. We have started putting all of our contracts in there. Our contracts were not, they were started to be put in as we are working on them. So we are hoping that that will mitigate some of this from coming forward in the future.
Well, and a final note then, I do want to express my appreciation that when this problem did develop, you brought it to our attention, but as soon as it did develop, you took the corrective actions to begin immediately the bid process and so forth, and I do appreciate that very much. Thank you.
Mr. Ashcraft.
Thank you, Mr. Chairman. I think Mr. Klicka hit several of the points that I was going to raise. I had the opportunity, Mr. Chairman, to visit with Ms. Lyons and staff yesterday. It was very helpful. I did have some difficulty kind of sorting through the briefing sheet what it was trying to tell us and how it was presented. I would feel much better, as I had stated before, if I had seen the pricing and understood the logic a little bit more succinctly, but I think the move makes sense, and I think the staff has done their due diligence, and while there was maybe a bit of a stumble with the transition, those things happen. That's not a significant issue for me, so I will be supporting this, but I again would very much appreciate having the cost comparisons as well as just the interview rankings.
Okay. Other questions? Mr. Brown.
Thank you, Chairman. Only to second Commissioner Ashcraft's comments about seeing the numbers as we compare these things. Thank you.
Any other comments, questions? Is there anyone present who would like to address the Commission on this item? All right, there being no one to be heard, is back before the commission. A motion to be in order, Mr. Klicka.
I move to authorize a contract extension and amendment with Crystal Clear Enterprises for custodial services in an amount not to exceed $290,000 to cover the time frame from May 1st, 2017 to April 30th, 2018, and authorize a new countywide term and supply contract for custodial services with Crystal Clear Enterprise, Inc., at a cost not to exceed $875,000 annually per request for proposals 2017-69 for a period of 24 months with the option to renew for 3 additional 12-month renewals.
Second. Motion has been made and seconded to approve the proposal in regards and make the award to Crystal Clear Enterprises, Inc. Any further questions or discussion? Being none, clerk, please call the roll.
Commissioner Schaefer?
Aye.
Commissioner Allen? Commissioner Klicka?
Aye.
Commissioner Osterhaus?
Aye.
Commissioner Ashcraft?
Yes.
Commissioner Brown?
Aye.
Chairman Eilert?
Aye. Motion carried. Are there any other items on the action agenda?
No, sir.
All right. Turning to reports and communications, Ms. Posto-Ferguson.
Good morning, Chairman and Commissioners. I would like to say thank you to Commissioner Klicka to bringing up World Down Syndrome Day and sharing that video with us. And I echo the comments that Chairman made about living in a community that embraces that and working for Johnson County government that provides services to special needs population. So it makes me proud to work for this government. But I will just say on that note, I'm glad you didn't record me singing in the car with my daughter because
It was karaoke, so you really didn't have to just go through motions.
We can arrange for that.
You have before you 2 items, and I want to add a third one to give you an update on an item. But first of all, the City of Shawnee will hold a public hearing at 7 p.m. on Monday, March 26th, to consider the issuance by the city of its federally taxable private activity revenue bonds, not to exceed $3.4 million, to finance the costs related to acquiring, improving, equipping, and furnishing an approximately 46,326 square foot commercial building located at 8450 Cole Parkway. And as noted in this paragraph, questions had been asked before about whether the board can take action. This is one of those that the board cannot take action, but this is information to help let the public know and let you be aware. The second item is the City of Bonner Springs. They will hold a public hearing at 7 p.m. Or 7:30 p.m. Monday, March 26th, 2018, to consider the issuance by the city for industrial revenue bonds, an approximately principal amount of $17,263,122 for 79,000 square foot bus dealership and service facility located at 23889 West 40th Street. And this is for 75% of the taxes up to that would otherwise be due and payable for the first 10 calendar years. And you have the information attached. And again, this is not one, the board may comment on the issuance of IRBs, but cannot veto the city from issuing the bonds. And the third item, it's not in your packets, but it's an update that happened over the last couple of days, and so we didn't have time to put it in the manager's memo. But last week, in response to the board's direction to conduct a review of Johnson County Fire District 2, staff and Commissioner Klicka met with the fire board on Tuesday. The fire board chairman, the treasurer, fire chief, and financial officer. And I have asked Maureen Thompson to lead a team to conduct the review. The meeting was productive, and they're cooperating with us to set up meetings and exchange information. And as part of our staff team, it includes legal, emergency management and communications, county auditor, and the budget office. With that, I'll stand for questions.
Questions? Mr. Ashcraft.
Thank you, Mr. Chairman. Thank you for the third note. I know there had been some discussion, so thank you, Mr. Klicka, for involving yourself in that. That district is in your district, as I understand it, substantially or completely. So very, very good. On the IRB from Bonner Springs, is there any information on how that may or may not affect potential revenues for Johnson County? Because it says a payment in lieu of taxes. Those resources go just to the city. The county or school district does not get any part of that. I'm correct?
Well, we did ask for follow-up information, and I don't know on this one if we received it, Chris. We hadn't received it yet, and then Don, I think you have something to add.
I think on all payment in lieu of taxes, they have to be distributed proportionately.
They do. Okay. Well, that's a very important clarification. I just didn't see that there because not to be argumentative, but I thought in some situations the cities were the only ones that received it. But if I'm mistaken,
there are at times private contracts where they agree to pay a fee or a certain cost that they can do that. But if it's a payment in lieu of taxes, it is
very good.
Distribute.
Thank you for that clarification.
Okay. Any other questions? All right. Does that conclude your report?
Yes, thank you.
All right. Legislative update. Ms. Green.
Good morning, Chairman and Commissioners. Cindy Green with County Manager's Office. The House and Senate are very busy as we get close to wrapping up the session where bills are being introduced except for exempt committees. So there's been a lot happening up there. Probably the primary focus this week, though, has been on the education information that was presented last week and multiple discussions going on there. The number came in much higher than many expected, so they're trying to evaluate those numbers and the impact and where those funds could potentially come from, plus fund all the other items that they are trying to do this year. Some other just bill numbers. In the Senate, they worked on Senate Bill 400, which is where a county, if under the tax lid, they take in another taxing entity that is disbanding. In this case, it's a county specifically working on their airport to bring it in under the county. If they did so, they would be able to take those funds and increase their limit to where they start from for the tax lid, and then the increment would be just like it would for any of the other budget items they have going on. A bill passed out of the House on that already, and it is sitting below the line, or not, it passed out of the House committee. It's sitting below the line in the House, but they have introduced a bill on the Senate side. It's Senate Bill 400. Had hearings on it this week, but it has not come out of committee yet. Star bonds is also getting some attention this week in Senate Commerce. They worked the bill yesterday but did not pass it out. They anticipate some additional amendments today and possibly something being passed out. So we'll have a report later for you on that as that happens. On the Senate side, they also were working the Transportation Task Force bill and making some changes to that. They put it in a new bill number, which is called a gut and go, and so it's now Senate Bill 391 if you've been paying attention to that one. And again, it's not come out, but we will keep an eye on that one. And then on House Bill 2780, this is where the county would have to pay property tax appeals, cost associated with it. It had a hearing on Tuesday, but it has not been worked. We will watch that one closely. We did put in testimony that opposed that bill because the language in there, cost associated. So there's no definition. It's if you hire an attorney, what is cost associated? That's a pretty broad number. And if you take the number of appraisals that we review every year and then have to pay those fees on it, then does that then just incentivize more people to appeal also too? Not that we don't want people to have the opportunity to appeal, but if we have to start picking up all the cost on both sides of that, it could be very expensive for the county.
Well, let me ask you this. I hope the legislators understand that county cost is a taxpayer cost.
And we did put that exact language in our testimony.
If taxpayers have to start paying attorney's fees for appeals, I don't think that's right. So, Mr. Allen.
Just one quick comment. I think really the big dollars potentially could be the commercial appraisals that with the time and when you have buildings that are worth substantial millions of dollars, that some of those attorney fees or whatever could be $10,000, $25,000, and then all of a sudden in a county this size, you could literally have hundreds of those appraisals going on, especially if they have a chance to get reimbursed. Be very significant impact on that. And at the end of the day, the taxpayers would end up, unfortunately, have to pay it.
Mr. Brown.
Thank you, Chairman. Cindy, when I had heard about this bill and got some feedback on it, I had the understanding that it was in the event that the person appealing is successful, then the county would be responsible for paying, not all payment. So do you know for sure?
That is correct, Commissioner.
Okay.
And so I didn't clarify that. That is correct. But then what is that? What if we only adjusted it $100? You know, you have made an adjustment. So then do you pick up all their costs for that? So there's a lot of, you know, concern there of the wording.
Yeah, we have thousands of appeals every year, and the success rate is between 40 and 50% on that.
So.
It's, you know, everybody is entitled to appeal their property, and that should go without saying. But in the case of the taxpayers having to pay the cost of the appeals, I don't think that's right. So anyway, okay, keep us posted.
I will. And then just the other final bill that we're keeping a close eye on that was introduced, I mentioned a little bit last week, House Bill 2779, Representative Tom Cox, in regards to people over 65, them being able to exempt $2,500 or put it on hold and not pay it till the house is sold and different things. So we are going to be having a meeting internally because there's some concern of the cost of what that would be to the county. So we've not heard that there's going to be a hearing on this yet. I talked to Representative Cox on Tuesday, and he's trying to get a hearing on it, but there's a time crunch at this late in the session, and so tax chair wasn't sure there'd be time to hear it this year, but we at the county want to be prepared to understand what would be the impact on us and the cost and the banks and the liens, and it's a very complex bill that we want to understand.
Mr. Osterhaus.
Cindy, is that bill being written for the entire state or just for the large urban counties?
I believe it's written for the entire state.
Okay, because I know there's a number of counties that their populations are heavier weight of those that are over 65. So I don't know if it's worth our time talking with Kansas Association of Counties as well on that.
And we will be doing that. That's a great point. I appreciate that, Commissioner.
Anything else?
The only other thing is another one of the governor candidates picked a lieutenant governor, and that was Secretary of State Chris Kobach picked Wink Hartman, who had just dropped out of the race recently. So that's my report this week.
Mr. Green, thank you. Very good presentation. You do a great job. I was wondering, though, do you have any update on the dark store debate that's been fomenting for the last few weeks?
Yes, that should have been on the top of my list because Chairman Eilert actually went out and spoke to Senate Tax Committee yesterday to continue the conversation with them, and I was not able to attend because I was in the process of moving officially into Johnson County. You all know that I own a home now in Johnson County after joining the county a few months ago. But Aaron Otto attended with him, and if either one of them would like to speak on feedback they felt from the committee?
Well, I appreciate the opportunity to express the majority of the board's opinion about the hypothetical conditions that are being advanced both from a dark store and a lease fee idea and the impact that those kind of decisions based upon those kind of hypothetical conditions for commercial property would create. And there were a lot of questions. I hope I responded to them appropriately. And again, no decision. It was more of an informational. So do appreciate the committee's time and allowing that opinion to be expressed. Yes.
A follow-on question, Mr. Chairman. There was an email yesterday with some information and a table showing the potential impact. I wasn't sure, was that from our staff or was that from legislative staff, and was that from like Paul Welcome or someone in budget? I wasn't quite clear.
No, it was from our staff. I had asked the appraiser's office to look at the various classifications of commercial property where these hypothetical theories might be applied.
Okay.
And so as a result of the impact on school districts, all taxing jurisdictions in Johnson County.
And the state.
Well, we didn't do the numbers on the state, just for Johnson County.
But the impact on the state from Johnson County, wasn't
Right,
that in? Yeah.
right.
Okay.
I mean, the biggest impact would be on the schools. School districts collectively would lose something like $32 million.
Is that annually?
Yes.
Okay, that's
right.
I wasn't sure.
And the state of Kansas would lose on its mill levy for funding schools statewide. They would lose about $15 million a year. Seems to me like with the funding decisions that are faced in Topeka now for public schools, that that might be a concern to the legislators, but that was not demonstrated yesterday. So, okay, thank you.
You're welcome.
Ms. Marsh. Your turn at the podium, please, or at the desk. The Board of County Commissioners, by state statute, sits at the public board of health for Johnson County. And so we are currently in that position. And Ms. Marsh, who's director, will give us a report.
Thank you, Chairman Eiler and Commissioners. We're happy to...
Microphone.
Yeah.
Microphone.
Microphone.
Green light needs to be on. Move it closer.
Green light on? Yeah. Oh, it was green.
Talk
now it's
into the
greener.
microphone.
All right. When I saw the green light, I thought I was good to go. So Lou Jean Marsh, Director, Johnson County Department of Health and Environment, and Chairman Eilert, Commissioners, we appreciate the opportunity for you to sit at the Board of Health and receive a few updates from our department about current business, things that we're working on. I want to start just by acknowledging and introducing to you a new member of our executive group, Megan Sadler, who's sitting behind me, recently joined our department. She came from Treasury and Financial Management and is serving as the Division Director for our Business Operations Division. So wanted to acknowledge her joining our team. We have about 4 items that we want to address with you this morning, and one is just to kind of give you an update on planning for the medical examiner coroner operations as we look forward to having our own facility here in Johnson County. Certainly, I'm not planning to talk with you about the building itself. There are certainly, those efforts are being led by our facilities department. I'm pleased to be part of those planning discussions, but really want to talk with you about things that we need to be considering, especially beginning in 2019. So you might be thinking, well, we don't open this facility until 2020, but in our budget proposal for 2019, I am proposing that we recruit and hire a chief medical examiner for Johnson County to begin early next year. Later in the year, we'll need to plan to bring on a medical legal death investigator, as well as a deputy medical examiner, some forensic technicians, and the chief toxicologist. Those would be proposed to be added to our staff much later in the year in December. So some of the reasons for thinking about why we need to start this position in early 2019, I've gone through a significant list of the expectations and the work that needs to be done, because just as a reminder, and I know you know this full well, we currently have all of this medical examination work completed by a for-profit entity in Wyandotte County. So that group is responsible for the autopsies that are ordered by our coroner and his deputies. They write the reports that are then associated with those autopsies. Any specialty work that's needed, they're responsible for all of that. But all of this work now will be absorbed by Johnson County. So there's a great deal of work, ground to be tilled, to be prepared for opening that operation in early 2020. I particularly wanted to point out the relationships that have to be built. When we were visiting a medical examiner operation in the state of Maryland, you'll probably remember that Dr. David Fowler, who is the chief medical examiner for Maryland, was the consultant for this proposal that was brought forward to you a couple of years ago. As we were talking with him, especially around the death investigations, Chris McMullen, our deputy district attorney, was with us on that visit. And he described this as being a sea change, because currently the investigative work is all completed by law enforcement. So this whole concept of a death investigator is new conceptually to our law enforcement community. So that's a key relationship that will need to be built as we move forward and prepare for doing all of this work here in Johnson County. So the list goes on. I'm certainly not going to go into detail about all of this, but I felt like it was really important for you to begin to understand the breadth of work that we have before us in being prepared to operate a medical examiner facility. So significant acquisitions of equipment, software. So we'll have to do, for many of those items are of a price that will require requests for proposals to be issued, getting those bids back, making decisions, as well as overseeing then installation of that equipment. And then the recruitment of the additional staff that we'll need to hire later in 2019 and on into 2020, and the training of that staff. So much work to be accomplished in 2019. I mentioned specialty kind of work that's associated with autopsies. I've listed some of that. These items are not things that we'll be doing internally in our own facility because they are less frequently required. It would be much too expensive for us to hire the expertise to do these, so we'll have to have contractual relationships with specialists in those areas. Something that I've begun realizing is there's also tissue recovery that will be associated with decedents for whom we're performing autopsies. So building those relationships and agreements with the Midwest Transplant Network will also be part of the work that we'll be expecting our chief medical examiner to complete in 2019. And then this whole transition of services from our current contractual provider, Frontier Forensics Midwest, to our own facility. So as we begin to get closer to beginning operations, we know that there are potential efficiencies with crime lab staff related to toxicology and death investigations. So those are efficiencies that we'll be wanting to explore once we have a chief medical examiner on board. In addition to making sure that we go through this rigorous checklist of items required by the National Association of Medical Examiners, because once we're open, we want to make sure that we'll be positioned to become an accredited facility here in Johnson County. We will need to secure additional staff so that we're ready to operate in 2020. We anticipate being a 8 to 5 operation initially, but knowing that the demands for services occur 24/7, we will only be hiring one full-time medical legal death investigator, so that will require that we recruit, train, sort of some relief individuals to respond to unattended deaths that occur overnight and on the weekends. Of course, an operation like this will require administrative support, so we've identified the need for those positions, but those can be hired early in 2020. And then just as now, there will be a need for deputy coroners, again, to have availability 24/7 to respond to those unattended deaths that require review by a coroner and decisions made about whether an autopsy is to be required. So that really concludes the overview that I wanted to provide to you this morning related to the medical examiner operation. Can either answer questions if you have them now.
Are there questions at this point? Mr. Ashcraft.
Thank you, Mr. Chairman. Thank you, Ms. Marsh. Very good summary. What role or involvement will Dr. Prosser have in this, or has he had, and will he have?
So Dr. Prosser, our current district coroner, has been involved with the medical examiner design team, even prior to that, in the study and proposal that was brought forward to you in early 2016. As his schedule allows him, he has been involved in our conversations related to the design of the facility and planning operations. Dr. Prosser's current appointment will expire in early 2019. Those are 4-year appointments. So there will be discussion needed with this board in thinking about whether you want to consider reappointment of Dr. Prosser as district coroner, or whether you may want to consider appointing as coroner the individual that we recruit and hire to serve as chief medical examiner.
Okay, fair point. I was just wondering, and that's fair to talk about that as future conversation. I was just wondering how those two meshed. And I will offer that I will be interested in understanding the cost benefit between the current model we use and this new model under the guise of our own facility, if that makes sense to you, because it looks like it is going to be a sea change, and it's going to have a lot of green water in it.
I think you're probably right about that, and certainly as I've prepared a budget for 2019, recognizing that we already have a budget for the coroner services that's around $650,000, and that's to contract for those services as well with Frontier Forensics, as well as compensation for Dr. Prosser and the deputy coroners.
Very good. Thank you.
Certainly.
All right,
okay.
Thank you.
So we'll be moving on now to talk about measles.
Do we have to?
All right, good morning. Nancy Towns, I'm the Health Services Division Director. And, closer. Is that better?
No, okay. Not yet.
Thank you for this opportunity to discuss the measles outbreak that's currently ongoing. Our job is to identify and contain disease, and I want you to understand the depth and the intense labor involvement that goes into this. Okay, short overview of measles. Measles is highly infectious. You can be in a room, and if they're seen in the doctor's office, the room cannot be used for 2 hours after that current person was in there. It can take up to 21 days after an exposure to come down with measles, and there's severe complications such as encephalitis or pneumonia. The symptoms, they start typical, similar to flu. Cough, congestion, you could have some runny eyes, you get a fever, and then about maybe 4 to 5 days after those symptoms start, you get a rash, and the rash usually start on your head and then move down to your trunk. Previous outbreaks we've had one in 2008, 2011. Prevention, vaccine is the best prevention for measles. Of course, no vaccine is 100%, but still this is the best prevention. Routine schedule for measles vaccination, which is an MMR, measles, mumps, rubella, is at 12 to 15 months. And then again, a second one probably before kindergarten or when you are totally in daycare, about 4 to 6 years of age. Johnson County does have a higher rate than the state rate of 84%, 86%. It's about 94% of kindergartners that are entering have their 2 measles doses. And people that are born before 1957, they're considered immune because they probably have the disease or they've been exposed to someone with it. This current outbreak began on the 8th of March. I got notified probably about 7:30 that evening about the possible measles case. The next day was Friday. We started running with this. We have investigated probably about 22 cases, and there are probably more now. That means investigated. We're following up on reports of possible measles cases. These numbers were put in at 5 o'clock on Monday, and since then we have identified another case, and so we're up to 11. So under 1 year of age, were 8 identified, and then over 1 year now there's 3. What happened with most of these kids that were under 12 months of age, they went to the doctor and were identified with an ear infection. That is another side effect of measles. And they ended up usually having a couple visits at the doctor's office. And it was misdiagnosis. A lot of the doctors now have never seen measles, and so that's not what they're looking for right away when they go into the office. 3 of these were hospitalized, and dehydration, breathing problems, again, because these were infants. Those happen quite frequently with that age group. Okay. All right, contact tracing. What contact tracing is once you identify a case, who has been exposed to that case. And you can see on the list here how many follow-ups we had to do once we identified people that were exposed to the initial index case. As this expanded, we found that people were, going to grocery stores, they were going to movie theaters, they were going to restaurants. Well, we're not going to know everyone that's walking in those places. That's why we put out a press release with those places identified. So hopefully telling people to watch for symptoms, and so they can notify their healthcare provider or us. Total, there were, and that has been updated to 431 contacts, and that again means people that we followed up on that we thought could possibly have been exposed and possibly could come down with symptoms. And you can see in this, as this investigation expands like this, we try to keep confidentiality very close to us. It's very important that we try to keep all the patients involved, contacts, confidential, so that it's just not out there. Okay. All right, investigation and control measures. What this means, susceptible individuals means people that have not been vaccinated, or they can't be vaccinated, they're immune compromised. So what do? When we find these contacts, again, ones that have been exposed to a case, we need to tell them what symptoms to look for. When are the symptoms going to start? If they are susceptible, again, unvaccinated, they need to stay home for 21 days. That means stay away from daycare, stay away from school, stay away from work if they're not vaccinated. That is a Kansas statute, and that is listed here. Now, there are things we can do for prophylaxis after this. For the infants, again, they're too young to be vaccinated, especially if they're under 6 months of age. We can give gamma globulin. Gamma globulin is not a vaccine, it just boosts their immune system. So hopefully it could prevent the disease or decrease the severity if they did come down with measles. Now, you can also give MMR vaccine within 72 hours of exposure, but again, it has to be within 72 hours after exposure. So, okay. You can see there from the staff response, again, how labor intensive this was and how many people we had to pull in to help us with the investigation. And the staff hours and the costs are listed up there. Okay. All right. Extent of outbreak. Now that we've added that additional case to 11, 3 Kansas counties were initially involved. Us, Linda, Miami, and now Wyandotte is involved. Also St. Louis County because of travel. And then both the Kansas and Missouri State Departments of Health.
Are we a pocket?
Excuse me?
Is this just a pocket outbreak, or are there other locations nationwide?
There are we are not related to the other, there was an outbreak, I think, about the same time, I think from an airline, and I think there were some Missouri people involved in that. This is just, it started here in the daycare, and then, and then just kind of went out as we followed the contacts out. And of course, communications and media, that's always important. You want to have a standard message. You don't want to be saying, 10 different things to 10 different people. So you can see listed here what we did there. We did have conference calls every day, 2 times a day, that's still going on since we were notified of this, with all the counties involved and with both state health departments. I think that's the last slide.
Right, so that's our measles. That's our measles summary, and if there aren't questions related to that.
I have one question. Has it peaked, or do we know, or?
We're still investigating the possible cases. Yes, with
And another
contacts.
question I have is, I heard something on the news the other day that older children, I'll put it that way, who might have been vaccinated are in some cases coming up with measles. Have we had any experience like that?
We have had some experience. We do follow up. Again, there's many variables that might be because of that. Might be storage of vaccine. It might just be someone's immune system. It could be vaccine failure. It could be a number of things like that.
Okay. Other questions? Mr. Ashcraft.
Thank you, Mr. Chairman. Not to draw comparisons, to me, I always find it just horribly fascinating how diseases like the Spanish flu or something like this just seem to emerge. But I wanted to ask you about your communication plan. I know Mr. Brown and I think Mr. Thomas have put some things out on social media, but a press release is necessary, but this may be an opportunity for us to kind of expand our communication plan on situations like this to get the word out, because this is very helpful, very useful information, but internalizing it and understanding it takes more than a press release sometimes. So I know you're doing work, but just as general information, just a suggestion that...
And you're exactly right, Commissioner. We have, the social media, I think, has been pretty effective also. I think that, that with just talking to media, and media has called several times and you know, in all kinds of, what do you say, all types of media. What can we do to help you?
Okay.
So,
good.
yes.
It's been on national news, actually.
Yes, it has, yes.
Mr. Brown, do you have a question?
Yeah, because this is not my world. I'm a contractor. If you want to know how far a steel beam spans, I can help you with that. This is not my world, so I'm going to ask you a question. You said that there's a case in Missouri that was due to some airline travel. So somebody from somewhere showed up and brought measles forward, and then that's the genesis of how that arrived there. You said our case is different, and you said, is this traceable back to a person? And if it's traceable back to a person, where did they get it? How did that happen? Wrong question. Is that right? Is that accurate? Did they contract it somewhere and bring it here? Or does it just appear in somebody? How does that work?
There's, measles is not in the United States, and so it's pretty much, it's endemic in other countries, Asia, Europe, wherever. So travel, you know, you could get it at Walmart, you can get it at Target, you can get, you know, if you don't know. So that's why we do investigations. Sometimes you never find the index case with that.
But it came from somewhere.
Sure.
It got introduced into Johnson County from outside of America. That's somewhere. Okay.
Right, and what we do also is some of the specimens have been sent to CDC. We do genotyping on them, and then you can, you know, trace what part of the world that the measles strain has come from.
Thank you.
It's always interesting that the exposure time, what is it, 2 days? Or
After you have
how
been
many hours?
exposed.
If I'm unknowingly going to a doctor's office and I'm diagnosed as with the measles, and everybody in the office has been exposed, so it's fairly easy for it to expand. Yeah.
It is. But the doctor's offices and healthcare facilities have been very cooperative, and we've contact with them every day, multiple times a day, and they have been, cleared people out, not used their rooms, and taken people in back doors and all.
I think I misspoke. It's 2 hours, not 2 days.
You're right.
But it's a really great point, Chairman, and one of the reasons why in our media releases and in interviews, we have stressed the fact that if someone has those early symptoms and think they have been exposed because of the media releases or notifications from their healthcare provider, that they don't just show up at the doctor's office, but call in advance so that those precautions can be made to prevent further exposure of other individuals.
Well, good work. It recalls to mind the TB situation that you all had to deal with here a year or two ago.
Exactly.
So, good job. Okay.
Can I ask just one more question, Chairman?
Yes.
Would that be okay? You said 21 days, basic home quarantine. And that statute, Kansas statute, is there compliance? Are we having
Yes,
anyone
we have-
pushing
no,
back?
We have not had any problems
Okay,
with
good.
that. No,
Thank
they've
you.
been very cooperative.
All right.
Thank you.
All right.
Okay,
You got
well-
another item.
We do, and I apologize that our clicker doesn't seem to be working, but it doesn't. So that puts our next presenter at a little bit of a disadvantage. But Roger, I'll try to keep an eye and move the slides forward.
Great, thank you. I'm Roger Lamson. I am honored to be the chair of the brand-new Johnson County Food Policy Council. I'm surrounded by an amazing group of 16 people who represent all segments of the food system in our community. And I want to talk to you a little bit about what our council has done since its formation. The mission of the Johnson County Food Policy Council is to improve the health and well-being of individuals, the community, and our environment, along with a just and equitable, sustainable food system in Johnson County. Through policy recommendations, education, and collaborations, we strive to increase access to healthful food that is locally produced when available. A real mouthful, so our mission is really very, very large and very, very important. Since our establishment in 2016, as I said, we have 16 different representatives on the council that cover the whole gamut of the food system in our community. Our council has completed a food assessment of Johnson County. We have evaluated the current Kansas City metropolitan area food system. We have found that Johnson County is rich, diverse, and fat. We have a huge number of restaurants and fast food organizations. We have a growing number of people who are obese and diabetic. So that is an amazing consequence of our affluence. We have formed 4 different working groups to address different components of this whole system. And those are local food development, food insecurity, hunger-free health care, and food waste solutions. If you look at this chart before you, you can see that the food system in our community is very large, is very complex, beginning with production, processing, distribution, marketing, consumption, etc. Because it is complex and encompasses so many different aspects of it, it is governed by a myriad complex of government and business organizations. So changes in that system are very, very complicated. And so the development, the Food Policy Council has a challenging job to influence any problems we find within that system. One of the things that we have learned in our studies is that people are more interested in local foods than they have been before. If you look at Kansas, we're largely a commodity state. Wheat, corn, soybeans primarily. We grow very, very few fruits and vegetables. Those kind of things are brought in from all over the world, 5,000 miles away. So people are becoming more aware that if you get fresh, local food, it's more tasty, etc. Kansas, Johnson County spends $289 million annually on fruits and vegetables. So it's a big, big business in our community. If you look at Johnson County in terms of where we are and what we're trying to do, we have determined that there are 14 farms that are currently selling local fruits, vegetables, meats, or honey. We have 10 farmers markets, with a new one just being opened in Lenexa, which is important. The Overland Park Market, that's been around probably the longest, has 190,000 visitors annually. So it's a big business over there, and hopefully the Lenexa component will go even further. But another component is we have a large number of community gardens scattered around, and those gardens produce 21,000 pounds of fresh produce in
our community. If you look at our other working group, the local foods, one of the things we have discovered is that there are a lot of hungry people still in Johnson County. And so what we're saying is that we have 62,000 people who are residents who are food insecure. They don't know where the next meal is going to come from, particularly at the end of a pay period or what have you. If you look at those, we have 29% of those people who are eligible for supplemental nutritional assistance funds from the federal government. That is a huge, huge problem. And if you look at the number of people who are involved, that includes 7,000 children. If you look at the whole food assistance profile, you have SNAP, the Supplemental Nutritional Program, which covers much and most of meeting some of that need. But churches, food pantries, and so on play a very, very important role, and harvesters is a huge, huge component, feeding food to those feeding agencies. As you probably have read, the federal government, the current administration, proposes a 25% cut to SNAP. That will amount to a $94 million loss to the state of Kansas. So it's a huge, huge impact if that cut were to, in fact, proceed. Our Food Policy Council has gone on record as opposing that reduction to the SNAP program. If you look at the next component, next working group, we have now partnered with several practice groups, several hospitals in our community, try to get them more involved. We have that interface between the physicians or the medical staff interacting with the patients. We determined that hunger is a very, very important component of their disease status, and left untreated or left undressed, the severity of the disease, their diseases increase, and therefore their costs are important. Some of the hospitals have in fact even had discussions about starting their own food pantries, having food available to those patients that they have identified as needing assistance. So we are engaging the medical community and the education process. Our last working group is the food waste segment, and this is an absolutely humongous issue. If you look at food waste in the U.S., 63 million tons of food is wasted. In Johnson County, we estimate, based upon an analysis of what goes into the landfill, 303,000 tons of food end up in the Johnson County landfill. If you look at the source of where that waste comes from, you can see that about 10% it comes from where the food is produced, another 2% during the processing of that. Restaurants and so on contribute 40%, but the biggest chunk of waste occurs in our own homes. So it's a huge problem, and the economic cost is significant, totaling $218 billion. To address this, the food waste group, we have partnered with a whole segment of elements in our community to try to increase awareness of food waste and how it impacts all of us. Examples, we have just completed the preparation of several posters that we have printed and made available, trying to educate people about what food waste means. And that is very, very important if we're to reduce the waste. And one of our challenges as a Food Policy Council is how can we take that food that is now wasted and feed those people who are hungry? And that's the challenge. So we're currently working in those elements. So thank you very much for your participation.
Well, thank you very much. Good report. Thank you.
Can I ask a question?
Mr. Osterhaus.
Roger, let me see, I'm not sure what slide it was. I think it was slide 27. The 25% cut to SNAP, what's the economic impact to Johnson County? Do you know that number? If not, I can get it offline.
$94 million.
Statewide, or Johnson County?
That's Johnson County as far as I know. Is that correct? I'm not sure, but I think that's the case.
Okay.
But it is significant.
All right, if you could verify that, that would be good.
Thank you.
Yeah. Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Lamson, I am just tickled that you have so much emphasis on food waste. You said it was huge. It is, so good for you, and I want to encourage that. I was going to mention that Commissioner Brown and I had a conversation yesterday with some individuals from the city of Olathe that were talking about homelessness and the impact it has on nutrition and availability. So I think you're on target. The one thing on your graph on page 29 I was a little unclear on, where does institutional waste go into those four categories? Would that be under consumer?
Well, it's probably in the restaurant component, and probably also the schools have a huge waste component.
And that was...
And any of those agencies that feed a lot of people generate a lot of waste.
Because we were talking about schools, particularly the kids are required to take food, and so much of it doesn't end up in the intended location. And so I don't know if your program will continue to look at that, but good luck, and anything I can do to support that effort, because I mean there's a real rate of return there. It's a resource that's just it's available for harvesting.
Well, one of the things I have to tell you is there's some school districts that have failed kids who are in the food insecure group to make sure that they were required to go to summer school. That's a significant social method of dealing with food hunger, but it's a huge issue. We do feed a lot of kids through our backpack programs, but during the summer, it's not available. So,
other questions? Important. All right, thank you. Is there anything else?
One more topic. My name's Dawn Mangan. I'm the Community Outreach Program Manager, and I'm here to give you a brief update on the Nurse Family Partnership Program that was implemented in 2017. So the first year involved a lot of training. The training was extensive. It involved multiple subjects and venues that were both independent study as well as classroom study. Go ahead. We're providing, next one, I'm sorry. Next one. So currently we're providing weekly and bi-weekly home visiting early in pregnancy until the child is 2. The areas of focus include personal health, environmental health, life course development, maternal role, family and friends, as well as health and human services. So we focus on mom's strengths. We focus on solutions. We celebrate the small changes with the recognition that these small changes will lead to bigger changes. We also identify and work in areas where mom may need some extra focus in order that those areas can be strengthened and also lead to change. I'm sorry, go back again. And we do this because we know the negative effects of stress on unborn children and infants are well documented. We've learned that these problems need to be addressed with very early intervention. So by intervening early and working closely with mom, she can have a stable, responsive, nurturing relationship in these early years with her child that leads to lifelong, multi-generational benefits. Okay, go ahead. So Nurse Family Partnership has earned a strong bipartisan support in looking at the 40 years of research, which shows that the program leads to healthier mothers and children, also thriving families, and a pathway out of poverty. It leads to stronger communities and stronger government spending. Every dollar invested in nurse-family partnership now yields $6.40, that's the new data, in return to society and savings to government. Projected outcomes. These are projected outcomes for the year 2031, and they're based on women that were involved in the program from the year 1996 to 2013. And as you can see, those are some pretty significant outcomes ahead. So we, of course, have introductory outcomes because our program's in its infancy. We do have 100% of our babies are immunized. We have 100% moms breastfeeding. Our referral to actual enrollment is higher than the national standard. We have 147 women have been referred to our program. 58 moms have enrolled, and we currently have 32 babies that have been born. I would like to share just a few of our successes with some of our families in their steps toward their future. One mom we had working at Wendy's, she, with discussion between herself and her nurse and what her skills are and what her desires are, she is now a licensed interpreter, and it also enables her to work from home some of the time. We have another mom that was unemployed, and she is now in school to become a medical assistant. We have another mother that started and completed her certified nursing assistant program, and she's now interviewing for a job. We have another mom that is in the process of obtaining her real estate license. I have another mom that's completed massage school and is now employed as a massage therapist. We've done a lot of teaching and informing about public transportation options to those that we found that are overspending in cab fare. Some of the topics that we discuss are family finance, budgeting, as well as employment, because we found that many families are lacking knowledge in these areas. For instance, we had a family, the father was actually taking a cab to his job in northern Kansas City. Also, the family had no health insurance. So the nurse started talking to them about budgeting and how much money that they were spending on this cab fare and looking at various options like public transportation or other employment. So the father did end up finding a job right down the street. He can walk to work. He's eliminated his cost for transportation, and his family is now covered with a health insurance plan through his employer. So the community really has embraced this program. We are equipping families to change the course of their future, thereby changing the course of their child and also their children's children. So it's breaking the cycle of poverty and setting these families on a new trajectory. So we look forward to continuing working in the community with these families, doing our outreach, and making a difference.
Okay. All right. Thank you.
Questions?
Anything else?
No, unless you have other questions, I guess. It looks like
Well, I don't really have questions. I just want to say thank you. I've had the opportunity to work pretty closely with some of the Nancy's group in regards to flu outbreaks, and you guys are obviously, as we've seen in this presentation, doing really great things for the county, so thank you.
We appreciate that, and I guess on that note, I'll be sending Maury the most recent update on the flu outbreak, and we're happy to note that our most recent week had fewer cases reported, so we certainly hope that that trajectory continues. I also would like to remind you, I'm sure you saw the press release, that for several years now, Johnson County has been selected as the healthiest county in Kansas. And I think the work, some of the work, particularly the Nurse Family Partnership, the Food Policy Council work, are examples of the important work that our department is doing in partnership with the community to assure that we maintain that #1 ranking as the healthiest county in Kansas. So we really do appreciate the opportunity this morning to share with you some of the work that we're currently involved with.
Okay. Well, thank you very much. And that concludes our portion as sitting as the Board of Public Health. Thank you. Next, Mr. Kleffner, the Internal Auditor.
Well, Chairman, Audit Commissioners, good morning. Ken Kleffner, Director of Audit Services. This morning I have two presentations that I'd like to present, but before I start those, I would like to go off script for just a moment and brief the entire Commission on the Audit Committee meeting that was held yesterday afternoon. Yesterday we had our first Audit Committee meeting in 2018, and one of the topics discussed was an audit recommendation issued in 2012 that is still open in our inventory, if you will. The specific audit recommendation I am referring to is to centralize the procurement of IT hardware. And the recommendation itself has three components. One, to centralize the procurement of IT hardware. Secondly, procure from purchasing's recommended source. And thirdly, that all IT hardware being purchased must have approval of the IT Governance Council. I would like to acknowledge that action has been taken over the last 15 months to implement this. However, full implementation will not be achieved until 2020 under the current plan. And my objective of bringing this up at yesterday's Audit Committee meeting was to just inform the Audit Committee, provide some detail and some context as to the length of time to implement. The Audit Committee tasked the Chief Information Officer to develop a revised plan which accelerates the implementation and identify in that plan the financial impact. And that's issue number one. The second issue, the conversation evolved into a much broader discussion regarding information technology and how IT services are delivered to county departments, offices, and agencies. And specifically what I'm referring to, we discussed our current decentralized business model of IT service delivery. So for example, IT service delivery and personnel resources exist or are embedded, if you will, in the library, in the Park and Recreation District, gyms, and other county departments. This had a lot of momentum and a lot of passionate discussion, and the Audit Committee recommends staff develop a plan which centralizes or consolidates those assets and services under the umbrella of the Department of Technology and Innovation. And I believe that kind of summarizes the discussion, but I would like to open it up to those members of the Commission who sit on the Audit Committee if you'd like to comment or provide any input on that.
Well, thank you for that report. We do have a recommendation from the Audit Committee for an action item, and I'll ask Mr. Klicka, who's a member of that committee, to offer the motion to the board.
I'll do that, Mr. Chairman, but as a preface to this, the committee did meet to discuss this issue yesterday, and in fact, I think during the open meeting there were probably 5 of the 7 commissioners present here. A certain level of concern based on previous experience we've had with IT and the sensitivity and the security issues and so forth. I think the majority of the members that were present yesterday expressed concern on whether or not we were being as aggressive as we should in moving toward what the staff was recommending. And I think it was very clear that this concerns us. We need to move ahead. We need to get our arms around it. And also recognizing that we do have some agencies that are associated with the county, and they're a little bit extended beyond. My encouragement to them to work with staff to get that all tied together and get us all under one umbrella is extremely important and a very much high priority. With that, Mr. Chairman, I move, confirming the recommendation of the Audit Committee, I move that we direct staff to develop an accelerated plan within 30 days for the consolidated provisions of IT services.
Second. Motion has been made and seconded to approve the motion as recommended by the Audit Committee. I think I should note that there are some activities in the county who have specific technology requirements that might not be applied countywide, and so I support the motion, but I think we need to be aware of those circumstances. Yes.
Mr. Chairman, building on what you may have just said, I'm supportive of this concept and moving forward. I do respect, though, that we have two independently elected officials, the sheriff and the DA, that rely heavily on the JIMS system, the Justice Information Management System, whatever that, and there has been some historical interest in making sure that that system remains secure and at some level independent. And while I support this effort, I want to make sure that we respect that and that we consult with the sheriff and the DA and whoever is involved. And that may be what Commissioner Klicka was alluding to, because they are independently elected, and while it's the same technology and infrastructure, they do have certain sensitivities. So does that make sense?
Well, that's an example. That's one example. There are other examples, but then I think there are some areas where the coordination, central coordination could work, such as equipment.
And the purchasing process.
Programs, software, those kind of things could be different. But, yeah. Steve?
Mr. Chairman, and I'm going to be a little more adamant about this. I respect the other agencies and some of the self-interests that are out there in trying to promote their needs. But I'm also extremely concerned that many of those systems do integrate with the county. And if there's not a certain level of control from the county, the security that we want to promote within the system is just not going to be there. We're just going to lose control over it. So there is a balance, I understand. And manager, I assume that you'll work with those agencies to figure out the best balance, but with emphasizing that we don't want to go down this road again of some of the challenges that we've had in the past.
Okay. Any other comments, Mr. Osterhaus?
That kind of hits on my question, and Penny, maybe you can answer this. Have we reached out? Is this doable within 30 days? This accelerated plan, is that something that you're comfortable with?
We have reached out. The doable part, I'll look to Joe and Michael Aldridge, but we heard your sense of urgency, and so we can put together at least the first steps or an outline of a plan by then, I believe. But to some of the points that were made, a number of us, after yesterday's meeting, the managers called the directors that are probably maybe the most concerned or have a lot of interest, stakeholders. For example, I talked to the sheriff and the DA this morning, talked about it. Jill Geller and others have reached out to other directors to let them know where you guys are, and that at least, I was hoping for at least 30 days to work through with our partners on a plan that addresses your concern, balancing the other needs that were brought up today.
So, I mean, this is just a plan.
Yeah.
That's correct.
Yeah.
And Joe, I don't know if you have anything to add to that, or Michael.
I like the idea of the outline of a plan, because some of this, a plan or an outline of a plan, I think is doable in 30 days. Much meat on it will take more time.
And I'm going to say this, I understand there's going to have, dealing with the sheriff's office, dealing with the district attorney, and dealing with gyms and some of these other things, there's going to have to be some coordination effort. But I would expect those agencies to come to the table saying, how close can we tie into the goals of this county, not with the deal is that we don't want to play in the same ballgame. And I think As I said, I raised the urgency on this because of the time, the amount of money we've had to spend over some of the security issues, and the number of personnel have been affected by it. So I think we need to take a positive attitude, but it's in the interest of the overall county government.
All right, any other discussion, Mr. Allen?
Just one quick comment. To me, the security issue today, every day we see different security breaches in all different types of organizations, and the way we're set up today, frankly, for the environment we're in 2018, I think we need to take a very serious look. And to me, the security issue and building the firewalls and things that we need to do to our system with over 4,500 laptops out there, 100 and some different models, there's a lot of issues that need to be addressed. But the main point that to me that this is so urgent is we're in a different environment today, and we need to secure our system as best as we can.
Okay. Any other comments? All right, the motion is before us. Clerk, please call the roll.
Commissioner Schaefer? Aye. Commissioner Allen?
Aye.
Commissioner Clicka?
Aye.
Commissioner Osterhaus?
Aye.
Commissioner Ashcraft?
Yes.
Commissioner Brown?
Aye.
Chairman Eilert?
Aye. Motion carried. All right, thank you very much, Mr. Kleffner. You have...
Chairman, could I offer one last thing? There's been mention about security, and Joe or Michael might want to highlight very, very briefly. There have been a number of initiatives where we have addressed the priority areas. We still have further work to do, and we will do what you guys asked. It does make some sense. It makes sense to do that. But I do want to assure you that we have addressed the priority areas in security. We don't have to go into detail unless you'd like to, but I just wanted to.
Okay, thank you very much.
Mr. Kleffner, I appreciate you bringing this up and trying to rally the troops around this issue. And again, thank you.
Thank you, sir.
All right, you have another report to share with us? Pardon?
I have two.
All right.
The first one is our review of the district coroner's administrative activities. This particular audit was requested by the Director of Health and Environment, and I think it's just important to note that it was not included on our approved 2018 audit plan. If you recall, functional responsibility of the coroner's office shifted from the Johnson County Sheriff's Office to the Department of Health and Environment on January 1st of this year. So our objective was to advise the Director of any internal control issues that might exist or need to be addressed upon the transfer of that responsibility. Our audit scope looked at activity over a 4-year period. Our review looked at the coroner's office while it was assigned to the sheriff's office. However, the recommendations are actually addressed or issued to the Department of Health and Environment. Our methodology: most of our audit time was spent reviewing the cremation permit fee program. And secondly, we looked extensively at contract management. If you recall, in January of 2017, the Board of County Commissioners approved the establishment of cremation permit fees and certain investigative costs to be effective on March 1st of that year. Frankly, the implementation of the fee program had a rocky implementation. There was a 2-month delay in the actual implementation. There was little uniformity in the manner in which permit fees were received, and there was a lack of information provided by the remitter, which made it difficult, if not impossible, to reconcile the remittances. So as a result, due to the 2-month delay, the county experienced a loss of revenue estimated at $21,000, and as a result of the audit efforts and the audit staff identifying the tools needed to reconcile, additional revenue was generated at $20,000. We offered 2 recommendations. First and foremost, develop procedures which focus on the timely receipt, identification, and collection of permit fees. And secondly, re-engineer the process, re-engineer the remittance process. Remittances are basically on an honor system. Receipts occur sporadically throughout the month, and we believe it would be more efficient for the Department of Health and Environment to actually invoice the service provider on a periodic basis. And secondly, and importantly, use the county's Oracle Accounts Receivable module as the billing tool. Moving on to contracting practices, the district coroner primarily uses one vendor to perform autopsies and other forensic services. The coroner was operating under a verbal agreement with this vendor, and the working relationship was informal. In 2017, the services provided by this vendor approximated $500,000. The audit recommended formalize that working relationship between the two entities and enter into written contracts in the future when acquiring professional services. The next topic, financial interest disclosure, Several deputy coroners have a financial or beneficial interest in companies providing coroner services to the county. We believe these relationships need to be disclosed as required by the Johnson County Code of Ethics, specifically Standard 1101. The recommendation we offered is to determine whom within the coroner's office should file such disclosure and the nature or level of the reporting. The cremation permit process itself is the last topic, and it specifically addresses when a death occurs outside the state of Kansas. That process, when a death occurs outside the state of Kansas, it's different when compared to a death occurring inside the state. For deaths occurring outside the state, the district coroner has verbally authorized investigators to approve the cremation permit request. And we believe that this practice may not be in compliance with Kansas statutes. Our recommendation is to consult with the Kansas Department of Health and Environment, Office of Vital Statistics, and determine if the current practice is appropriate, and develop procedures to comply with the guidance received. Those were the 4 issues. The Director of the Health and Environment has concurred with all the audit recommendations, and Lugene is here to comment if you'd like. But before I close, I'd like to thank Dr. Prosser. He was a huge help in this audit. I'd like to thank Lugene Marsh, Sheriff Hayden, and last but not least, the audit team, John Holliday and Stephanie Berlin. And I welcome any questions you might have.
Okay. Well, thank you very much. As we progress to a different oversight or management structure to the new medical examiner's office, this information will be very helpful. Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Kleffner, of all the audits that you've done in the last few years, this one I find most substantive and in some ways most distressing. Some of the findings here are critically important, so I commend Ms. Marsh for bringing this issue forward and for your work on this. I do hope that we're able to identify some way to establish arm's length relationships between the circumstance we have with deputy coroners and the appropriate compensating controls. You pointed out the ethics. That's a step, but I hope that's fully considered, because that to me is distressing on the surface. I'm not suggesting anything inappropriate has happened, but over time that's just not good practice. So, and your comment about the honor system, you mentioned it here, that in 1900 or 18th century Dodge, that might work, but that just doesn't make sense. So I'm looking forward to changes there. And then finally, about the verbal agreements are binding. Possibly, but you're talking about nearly $500,000, and if one or both parties were to leave or die or something happen like that, that's just distressing. So I offer that just as a reinforcement, and I would hope, I'm going to direct this to the manager, I hope we don't have any other circumstances in the county where we're relying upon verbal agreements as binding when it comes to payments and responsibilities. And I don't know that that was in the scope of your work here, but that's not Johnson County. That's not good business anywhere.
Okay. So. All right. Thank you. Any other comments? All right. Mr. Kleffner, thank you. You had another item?
Yes. The next item is the status of audit recommendations as of 12/31 at the end of the fourth quarter. During the fourth quarter, there were 11 recommendations implemented, 6 from the election office transition audit, 1 from our joint audit with HUD regarding the City of Olathe's housing programs, and 4 from the Airport Commission transition audit. 44 audit recommendations remain open at the end of the quarter. Of those 44 in inventory, this slide gives you an idea as to the criticality to operations. Again, the criticality rating is management's assessment. The 39 of those 44 are considered either crucial or significant. This slide arrays the open audit recommendations by the particular audit they were issued from. And as you can see, the preponderance of those are from audits that were issued last year, the JCSO transition audit and the Airport Commission transition audit. Just a few comments regarding activity. The election office transition audit, we offered a total of 28 audit recommendations, and through December 31st, the election commissioner implemented 20 of those. He has modified the implementation dates for the remaining open recommendations, and I think that's, allow me to say that again. Ronnie has modified the implementation dates for the remaining open recommendations, but he is committed to implementing those by the end of this calendar year. I believe the election commissioner has done a good job addressing the audit concerns considering the challenge that he has faced since being appointed as the election commissioner. Next, the joint audit with HUD, which reviewed the City of Olathe's home program. This is the specifics of the one recommendation. The City of Olathe was required to implement a labor tracking system to record time and activity spent on the Community Development Block Grant and the Home Grant programs. Johnson County Human Services was required to monitor the city to ensure that the action they took satisfied the recommendation. Human Services completed their review in October of 2017 and found the city had essentially completed and reported the results to HUD, and HUD considers the recommendation implemented. And I don't know if you recall from that audit, but this was where all those dollars that they couldn't support, they were charging HUD. This should help solve that problem. There is a related issue that remains open with the HUD audit, and that concerns their home program. I just wanted to note that the county manager's office is working those issues with the city. On the Airport Commission, the audit offered a total of 19 recommendations. 4 were completed in the quarter and 14 remain open. And the table on that slide just indicates how Aaron views the criticality of those recommendations that are open. I believe there's good coordination between Aaron, the Airport Commission, and audit. And I believe in our discussions with him that each of those 14 recommendations are in some phase of implementation or completion. The management of IT hardware resources audit, this slide is out of date based on yesterday's audit committee meeting. So if you don't mind, I'll just skip over that. But that concludes my presentation, and I'd be happy to answer any questions you might have.
Questions? Much of this information was presented to the audit committee yesterday. So, all right, Mr. Kleppner, thank you very much.
Thank you.
Are there any other reports to be received? Okay. Turning to commission comments, Mr. Brown.
None, thank you, Chairman.
Mr. Osterhaus.
Just a greeting from the Overland Park City Council and an opportunity to be at their meeting on Monday and they say hello and keep up the good work. Meals on Wheels, had an opportunity to go out and visit with some of the residents in the 4th District, so always a pleasure to get to go out and do that. And then today I wore purple because K-State plays the Kentucky Wildcats, so in some way, shape, or form, a Wildcat will win that game tonight, and we hope it's our Wildcat. So, thank you.
All right, Mr. Allen.
Real quickly, I was at a Mid-America Regional Transit meeting this week. There's a presentation by Joe Reardon, President of the Kansas City Chamber, in conjunction with Google, and their analytical data that's available with a partnership between the Chamber and Google is quite impressive, and they're open to have Johnson County, if we're interested, to look at a couple areas and maybe do some reports. And initially, traffic patterns where people are coming from in the metro area, maybe to work at the intermodal traffic speeds. It's pretty impressive what they can come up with. The other one's my favorite area, travel time and traffic at possibly 75th and I-35. But I do have a card of a lady that's with the chamber. But in my opinion, we should take advantage of this. And there's very impressive data that they can track with people with their cell phones.
Yeah, yes, I'll have a comment. That Mr. Ashcraft,
The only thing, Mr. Chairman, is I hope we all had a weekend almost as nice as Mr. Osterhaus. Congratulations on your nuptials, and
Thank you.
May you enjoy the bliss that we all experience.
Thank you.
What are you laughing about?
Mr. Schaefer.
Where's Christie?
Probably watching all
Oh, somebody's going to have a talk with the missus tonight.
She doesn't watch, so we're fine. As well, I have my purple on today as well, celebrating the big game this evening. And best of luck to the other opposing team, the KU team tomorrow. Let's hope for a Final Four that has two Kansas teams. Okay, that can be better for all of us. So good luck to both teams tonight and tomorrow night, and this weekend, right? Okay, thank you.
All right, thank you. Well, Mr. Allen, you remind me the information was presented to the Greater Kansas City Chamber Board also was good information, but we're reminded once again that whenever you're online, somebody out there is tracking. So beware of that. Just a reminder. We do have a committee of the whole scheduled for 1 p.m. Today, and to discuss the courthouse schematic design, and depending upon when we finish this morning, we'll meet at 1 p.m. or as soon thereafter as possible. Saturday morning, the 24th, is a Johnson County Public Policy Council legislative breakfast at the Doubletree. And then, most important perhaps, State of the County will be Tuesday, March 27th at the Ritz-Charles, and all board members are invited, as well as the public. So, we do not have a request for an executive session today. That concludes our agenda. We are adjourned. We'll come back for a Spatial Public Building Commission meeting plus agenda review. Thank you all.
Thank you, Mr. Chair.